Hello everyone, my name is Isha and I'm a physiotherapist. Today here I'm going to talk about 5 most common conditions in your knee joint. But let's talk about the structures in your knee joint so we can head start. The few structures in your knee joint are your ligaments, your meniscus, your bursa. Bursa is basically a cushioning between your knee joint, followed by some tendons and of course your knee joint. Now let's talk about ligament injuries in your knee joint. There are a total of 4 ligaments in your knee joint which stabilizes your knee joint in the place. But one of the commonest injury or one of the commonest ligament that gets injured often is your anterior cruciate ligament. The anterior cruciate ligament is placed in the front of your knee and which helps in prevention of forward translation of your knee joint. Very commonly seen in footballer. Of course, the symptom depends upon the degree of the injury, but commonest symptom that you will see in ACL injury would be buckling, instability in the knee joint, swelling, pain, and giveaway sensation when you walk or do certain activities. Following to the ligament injury, let's talk about meniscal injuries. Meniscal injury again happen in sports injuries or considered to be one of the sports injury caused due to twisting movement in the knee joint, seen very commonly in cutting sports like tennis, football, so on and so forth. Few symptoms of meniscal injury is locking, popping, clicking, and difficulty in extending in your knee joint. Followed by that, let's talk about bursitis. As I mentioned to you at the start of our talk, bursa is like a cushion between the knee joint. So bursitis is basically inflammation of the bursa. Whenever any joint has an inflammation, it will release fluid and that fluid will go and sit at the open spaces of that joint. Now, your joint will appear looking puffier or swollen. Sometimes it can be tender, it can be warm, it can also cause stiffness and limit your range of motion. Bursitis is commonly caused in areas like where you have a job, where you have to kneel a lot, or probably high impact activities, so on and so forth. Coming to tendinitis. There are 2 tendons in our knee joint, a quadricep tendon and a patellar tendon. But the commonest one that gets injured is your patellar tendon because it's one of the load-bearing tendon in your joint. Patellar tendinitis is very commonly seen in runners because of the load bearing again. Now, few of the symptoms would be difficulty in going up and down the stairs, doing some activities in the gym, and few of the symptoms would be pain, stiffness, and also tenderness around the knee joint. Coming to the last condition is our very own osteoarthritis of the knee joint. Osteoarthritis is basically wear and tear of the knee joint. As you know, there is a cushioning between the knee joint, and when that tends to wear off, the 2 hard surfaces come together and cause friction, which leads to the inflammation of the joint. Osteoarthritis can lead to numerous symptoms, including pain, night pain, stiffness in the morning, difficulty in performing certain activities, including of your daily living activities, stiffness after walking couple of miles, so on and so forth. It is considered that osteoarthritis of the knee has the highest prevalence in females than males. I hope you find this information helpful. If you want to know more, definitely subscribe to our channel. Thank you.